I'm Dr. Keith Martin, the Executive Director for the Consortium of Universities for Global Health. What is planetary health? Let's find out.
So I think planetary health is an important concept trying to integrate various components of health, environment, veterinary health, individual human health. And as an engineering faculty, that is tremendously important for us to really develop a holistic understanding of these health systems and how it impacts us and the environment that we live in.
Planetary health is the health of human civilizations and the ecosystems on which they depend. It's about understanding the existential threat to our lives that we have very limited time to address the predicaments that we face.
Planetary health is thinking about the future and thinking about all the changes that are happening with the world affect not only the national population on average, but also different subgroups of the population. So my cut on planetary health would be to look at the poor, to look at the rural population and see how their lives are being affected by environmental change. It's not enough to look at national aggregated data because there are subgroups that will suffer more.
Planetary health. Well, you can't have a healthy population on a sick planet. And planetary health really means health for today it means health for today without compromising natural resources for tomorrow.
Planetary health to me represents a multidisciplinary approach to address interlinked environmental change, human health problems. So it represents an opportunity to work differently, to produce science and engage in partnerships to do the science that needs to be done to make the case to governments and other people in positions of authority to act to affect the changes that we need to save our planet and to save ourselves. They're connected.
Planetary health for me is an understanding that we all share the natural resources of the planet where we live in, and we have to have the right stewardship and the right governance to make sure that our children's grandchildren have livelihoods, have health, have happiness. Now, from a perspective of what we can do, we do need the right type of governance, the right type of policies, the right type of legislation in place, and to have this that is more people-centered and not necessarily economic-driven. I really think that we are missing the boat in many ways in some of the international collaboration, regional collaboration, to improve the lives at the community and family level are needed. Understanding and remembering that we as humans, we are terrestrial mammals. And so therefore living among how we produce our food, how we make the natural resources, the land use management decisions, needs to have the right policies in place.
To me, planetary health is really working on the issues where you have environmental pressures on populations and population pressures on the environment. And so if we're going to have a sustainable world for our kids and their kids, we're going to really have to work together across sectors, across disciplines, more than we ever have before, to come up with solutions and transform society into a long-term view where we can thrive and so can our children.
Planetary health is a new multidisciplinary approach to address the challenges that we're facing today, such as climate change, food security, sustainable cities, global security. So planetary health will aim to shape a new reality that will make the link between environmental change and human health stronger.
Planetary health represents the fundamental relationship between natural systems and humans. I believe that planetary health is essential to all generations, present and future, to have a happy, healthy life.